Hi, welcome to this short presentation on the role of social science in humanitarian action. I'm Tabitha Hrynick, a researcher with the Social Science in Humanitarian Action Platform, or SHAP for short. I'll present a brief introduction around how you can mobilize existing social science knowledge, as well as undertake rapid social science research to inform humanitarian action to ultimately enhance the equity and effectiveness of humanitarian interventions. A good place to start is with the question, what is social science? Well, broadly speaking, it is the systematic study of human societies and relationships. It encompasses a wide range of disciplines, including anthropology, sociology, political science, and more, with each discipline offering unique insights into social dynamics. Like all science, it uses systematic methods to observe, analyze, and interpret social phenomena. These methods include both quantitative approaches, such as surveys and statistical analyses, and qualitative approaches like ethnographic studies and in-depth interviews. Despite not being widely recognized, social science can be an important tool for humanitarian action. It helps us better understand the contexts and the people that are affected by humanitarian crises. For example, their local cultural norms, power dynamics within those communities, and social structures. And it helps us to understand responses and responders as well. It also enables us to identify and address vulnerabilities within communities, as well as recognize the valuable knowledge and know-how of people on the ground. It improves community engagement and participation by not only providing insights into local perspectives and priorities, but potentially also by enabling the creation of space for community members to sit at the decision-making table. This knowledge can also be used to shape and adapt humanitarian interventions around preparedness, response, recovery, and more sustainable and transformative change. Ultimately, by incorporating social science into humanitarian work, we can enhance the overall effectiveness and equity of humanitarian action interventions, leading to more sustainable and impactful outcomes. Broadly speaking, we can think of three roles that social science can play in humanitarian action. Firstly, we have the mobilization of existing social science knowledge. This involves rapidly synthesizing relevant social science knowledge and networks that already exist for insights that can help us design and adapt humanitarian interventions to the local context in which we are working. Second, there's operational social science, which is conducted in the field. This is real-time research, which, alongside what we've learned from existing knowledge, helps us understand emerging issues, which are sometimes very quickly changing under the circumstances and on the ground amidst the crisis. Lastly, we have longer-term social science research. This type of research addresses knowledge gaps, which might be identified during a crisis. It involves more in-depth studies conducted over longer periods of time, often initiated in the later stages of or after an acute emergency. The aim is to inform more sustainable change that address underlying vulnerabilities, enhance community resilience, and improve preparedness for future emergencies. Given the situation, context, and resources available, it might make sense to use social science in just one or perhaps in all of these ways to inform humanitarian action. In this video, we'll focus on mobilizing existing social science knowledge and on doing operational social science. Effective humanitarian response begins with a rapid assessment of existing social science knowledge about the affected area and population. We can rapidly analyze the context. You can check out the video on remote context analysis to understand likely vulnerabilities and sources of resilience on the ground, tapping into a wealth of existing social science research and expertise. This might involve remote evidence reviews of academic literature, of reports, and even media, as well as forming networks between responders, social scientists, and community members. For example, SHAP has facilitated roundtable discussions, bringing together public health and emergency responders with anthropologists to discuss social dynamics in the context of disease outbreaks, food insecurity, and conflict and displacement crises. These activities can help to inform early interventions as well as shape agendas for further operational social science work. Operational social science involves conducting research both within affected communities, for example, trying to understand why people may be quote-unquote resisting or not complying with public health measures during a disease outbreak, for instance, as well as within the response itself. So, for example, what health workers feel they need to support them to carry out their essential work safely and effectively on the ground. It helps highlight emerging issues on the ground using methods like rapid ethnography, surveys, interviews, and community engagement mechanisms to quickly gather relevant information. This research builds on existing knowledge and triangulates findings for a more comprehensive understanding. Importantly, it can involve a wide range of people. While local social scientists are often best placed to lead these kinds of activities, responders, health workers, and community members can also be trained in rapid social science methods. This broadens your capacity to gather and analyze vital social data in real time, while also making space for all of these critical stakeholders to have input into the design, the implementation, and importantly, the operational follow-up and actions that the research findings point to. While integrating social science into humanitarian action, there are several key principles to keep in mind. First and foremost is ethical practice, ensuring your research respects and protects participants. So think respecting people's autonomy, doing no harm, and treating people equitably. Secondly, it's important to prioritize ensuring our findings can directly inform response efforts. For example, a study focused on how many people report they will not take a vaccine is not as operationally useful as a study that investigates why people might report that they may not take one, or what kind of information or resources they want or need to support them to make this decision or to access a vaccine. Next, when we have findings to share, how we communicate them must be easy, quick, and accessible, avoiding jargon and using formats like briefs or even videos. At SHAP, we also advocate for a participatory approach involving local scientists, responders, and community members throughout the process. The more people involved in the research design and even implementation, the more likely it will have a positive impact. Timeliness is also crucial. You can use rapid methods that balance speed with rigor. Finally, the quality and value of social science is also enhanced when we triangulate insights and findings alongside data from a whole range of sources to verify and add nuance to our understandings, as well as to paint a more holistic picture of what is going on, and therefore set us up for being able to develop, design, and implement more successful humanitarian actions. Thanks for watching. If you would like some examples of how existing social science knowledge has been mobilized to respond to humanitarian crises, check out the SHAP website at www.socialscienceinaction.org. For great examples of operational social science, check out the work of the Integrated Outbreak Analytics Group. Do also check out our other legacy videos in which SHAP researchers break down concepts and approaches, bringing a social science lens to humanitarian issues.